Hi, I'm Dr. Joe Childs. I'm a board-certified chiropractic neurologist, and on this DVD today, I'm going to talk to you about Asperger syndrome. I'm going to talk to you about our Asperger syndrome program that we do in our office, and how we can help your child that's suffering with Asperger syndrome and possibly having poor social skills and not being able to sort of connect with other people and not being able to do the things that they would like to do or function as well as they can in school. We've been helping patients with all types of neurodevelopmental disorders, a lot of kids, a lot of teenagers in our office. We see kids with ADD, ADHD, we see kids with dyslexia, but one of the things that we do see a lot of are kids with Asperger syndrome. And on this DVD today, we're going to really discuss our drug-free approach to helping these kids. So let's get started. Let me tell you a little bit about myself. Again, I'm a board-certified chiropractic neurologist. And basically, a lot of people will ask, well, what is a chiropractic neurologist? Well, just like there are medical neurologists and there are medical orthopedists, and you can specialize in medicine, in chiropractic you can also specialize. You can go for more training beyond the core chiropractic curriculum, and I chose to specialize in chiropractic neurology. I took a board to become a board-certified chiropractic neurologist. Now, the difference between a medical neurologist and a chiropractic neurologist is a medical neurologist uses drugs and surgery for their treatments, and a chiropractic neurologist does not. We use specific types of nutritional care, metabolic care, and specific types of brain stimulations and things of that nature to improve neurological function. Also a fellowship trained in functional neurology, and basically functional neurology is drugless neurology. I'm fellowship trained in childhood neurodevelopmental disorders. I have been trained specifically by a doctor by the name of Dr. Robert Malio. He wrote the book Disconnected Kids. He's currently doing a lot of research in how kids can be helped without medication with neurological developmental disorders. So I've had that training. That is a add-on beyond the chiropractic neurology curriculum. I'm also trained in functional nutrition, which is nutrition based on specific kinds of lab panels and different types of testing. And I'm also been trained in blood chemistry. I'm trained in spinal decompression and spinal biomechanics. And prior to becoming a chiropractor and a chiropractic neurologist, I've been in practice here in Downingtown for 12 years. I was an exercise physiologist. So that's basically me, a little bit about myself. So let's get started. Asperger's syndrome is very similar to autism. In fact, they call it the right brain autism. The difference is they have excellent verbal skills. They're often referred to as the little professor syndrome, okay? Because they've got high intelligence. Asperger's kids are incredibly intelligent. And they have the trouble is they have an obsessive fixation on specific topics of knowledge. They get sort of, they perseverate or can have continual focus on one aspect of detailed things. And the reason why is because their left brain is firing so much and their right brain is firing so low. And we're going to get into that hemispheric understanding of Asperger's syndrome here in just a little bit. Asperger's syndrome, there's no clinical significant delay in cognitive development or language development. So they can, unlike autism, they can speak and they're extremely bright, extremely smart. They just have poor social skills, problems with communication. They have repetitive behaviors. The left brain, when it's firing too much, you can have perseveration or things that continually go over and over again. And they've got really poor social interaction skills, poor eye contact, and it's almost like they don't want to be in the world with other human beings. They want to sort of stay in their own world, and they want to look at small details and things like that. We're going to talk about that as we go further. So what makes us different than every other doctor you've seen? And I'm sure you've brought to your child with Asperger's to a lot of school psychologists and maybe child neurologists and things like that. But what makes us different? What makes us different is we treat your child's Asperger's metabolically, and we also treat it neurologically. Metabolically means we use functional nutrition to approach a kid with Asperger's, and neurologically means we do brain-based care. We're going to talk about what brain-based care is, non-drug brain-based care. If you have somebody, you have a child, you have a teenager, you have a friend's child or teenager that's dealing with Asperger's syndrome, I'm sure you're concerned. I want you to understand that we leave no stone unturned in getting to the root cause to discover why your child's experiencing this Asperger's. Why is their brain developed in this way that they're dealing with what's called Asperger's syndrome. So that's it. Now I want you to understand that in the last 10 years, this is an important statistic, the number of children in special education classes jumped in the United States 46.9%. I mean, it's huge. I mean, there's a it's a great health threat. The Centers for Disease Control called it a health threat. Okay, because we have so many kids with these neurodevelopmental disorders, not just Asperger's, but ADD and ADHD and autism and dyslexia and learning disabilities and OCD, things like that. They're just skyrocketing. But the trouble is the methods that doctors and psychologists and behavioral specialists use to diagnose and treat these conditions have not changed in 50 years. They're pretty much exactly the same. In fact, most of the time, if you have a child with ADD or Asperger's syndrome, what will happen is they won't even have a neurological exam. Doctor won't even touch them. They just sort of just watch them and look at them and things like that. So there are neurological tests that can be done to find out what part of the brain is causing a lot of these issues. Okay? So the question then becomes, or the statement then becomes, Einstein once said the definition of insanity is doing the same thing over and over again and expecting a different result. Well, if things haven't changed in 50 years for treating kids with these types of conditions, and I mean, that's insanity. I mean, they really have not changed anything. Okay? It's typically counseling and drug therapy. Okay? So here's the difference between us and what is traditionally out there in the standard of care for Asperger's kids or ADHD kids, is the functional versus traditional diagnosis. Well, the traditional diagnosis is a label. Okay? Basically, you put your kid in front of a school psychologist, or you put your kid in front of a neurochild psychologist, or something of that nature, and they basically watch them, and then they say, well, it looks as though he does have it, and what you've told me with these surveys, your child has Asperger's syndrome, and then they get this label. Well, you have to be very careful about the label you put on your child, because your child's either going to live up to that label, okay? And the self-esteem of the child alone is enough to really not label your kid. I don't like to label anybody that comes into this office. Now, we're going to talk to you about your concerns about your child, but we don't want that child being labeled. Okay? What we want to do is we want to do a functional diagnosis, which is going to look at specific areas of your child's brain and nervous system and find out which areas are responsible for the problem. Is it the dorsolateral prefrontal cortex in the right frontal lobe? Is it the right orbital cortex? Okay? Is it the left dentate nucleus of the cerebellum? Is it the brainstem? Okay? These areas can be checked for. I mean, a patient that has a right dorsolateral prefrontal cortex dysfunction, or I like to call it delay, in that it's not developed properly, they're going to have problems with focus. Kids with right orbital frontal cortex problems, the orbital frontal cortex is tied to the limbic system. These are kids who are going to be extremely emotional. We call them limbic type kids. They may have a lot of stress. They may have a lot of emotional outbursts, things like that. The left dentate nucleus of the cerebellum, they may have really poor posture. I've not seen an Asperger's kid yet come walking in with good posture. They almost always are sort of hunched forward like this, and that's because they've got poor cerebellar function in a lot of cases. We're going to talk about that. What we want to look at is the functional disconnection syndrome. Now, Dr. Robert Malio, who wrote the book Disconnected Kids, and he wrote several other books and is doing a lot of research at the F.R. Carrick Research Institute. It's in Long Island, New York. He coined this term, the functional disconnection syndrome. And basically what it means is that there's areas in the brain, the two hemispheres, when we look at the two hemispheres of the brain, the left and the right hemisphere, one side is functioning way higher than the other. They're not in the same, they're not firing in the same rate. They're desynchronized between two sides, meaning, and in kids with, I'll tell you, the kids with Asperger's, they have a decreased function of their right brain. We're going to talk about that more. And they've got a very high, fast, overacting left brain. Okay? So there's a functional disconnection between the two hemispheres of the brain. It doesn't mean that there's a separation. So the wiring between the two hemispheres are there. It's just that one is playing much higher and louder than the other, and the other one is playing a lot lower. It's kind of like if you went to the orchestra and you have all these instruments on the right side and all these instruments on the left side, but all the instruments on the right side are sort of playing out of tune. They're not as loud, but on the left side it's real loud and they're playing, and so it doesn't sound right even though everybody's playing. Does that make sense? And even though they're all connected to each other structurally but not functionally. That's a functional disconnection syndrome. And we're going to talk about that today and how that is at play in your child with Asperger's. So these disorders, ADHD, Asperger's, they manifest with different symptoms, but they're basically really one and the same problem. It's a disconnection syndrome between the two hemispheres. And when you're talking about ADD and ADHD, and especially Asperger's and autism, these are all right brain delays. For example, right brain deficiencies are ADD, ADHD, Asperger's, autism, Tourette syndrome, obsessive compulsive disorder, PDD-NOS, which is pervasive developmental disorder not otherwise specialized. Basically, it basically means that it's not quite Asperger's, it's not quite autism. They can't quite put it into a category. Your left brain deficiencies are going to be dyslexia. They're going to be learning disabilities. Okay, things like that. Okay, kids with Asperger's are incredibly good with fine detailed things. I mean, that's the opposite of dyslexia. They're incredibly good with numbers and letters and things like that. Okay? So let's talk about the left and the right hemisphere. It's important to understand the two parts. Because if you can understand what the left does and what the right does, then you're going to understand why your child is not functioning is functioning the way they are. Okay? So the left hemisphere is the gas pedal. It's what initiates thought, it's what initiates movement, it's what initiates action. Okay? It causes approach responses, it initiates movement, again, thought. That's why a kid with Asperger's can't sort of release sometimes with something that they're constantly overly thinking about. They perseverate on one thing. They may know everything about computers or everything about cars or everything about trash or vacuum cleaners or something like that. Where the right hemisphere is the brake pedal. It withdraws. It takes you away from thought. It stops movement. It stops thought. Okay, so here's the deal. If a child has a really strong left brain and a really weak right brain, they're going to have really poor focus in school. They may only be able to focus on the fine details of things. The left hemisphere is going to be small and fine motor movements, where the right hemisphere is going to be gross motor movements. So again, kids with Asperger's and ADHD must always have really poor posture because they have poor gross motor function. They're going to like high-frequency stimulation. They're going to love things like computers and video games and things like that. That's the left brain. The left brain loves that stuff, where the right brain likes more nature sounds and things like that. This is why you get a kid that's addicted to TV or addicted to video games or loves working on the iPad or the iTouch. It's the what part of the brain, so that's why a kid with Asperger's is so into the details of things, the what. Where the right brain is the where part of the brain. It's the big picture of the world. Okay? The left brain is going to be the memorization of facts. It loves facts. It loves data. It loves linear stuff. Okay? And so that's why these kids can get so connected to all these facts and figures and things like that. Where the right side of the brain is the nonlinear. It's the creative. It's the nonverbal. It's the nonverbal communications. It's being able to look at somebody in the face and understand if they're having an emotional feeling. Kids with Asperger's can't really do that so well. They can't look at the face of somebody and feel what they're feeling. They have poor eye contact. They have poor social skills. Okay, but they're very fluent verbally. Okay, so it's very important to understand. The right brain loves new things. The left brain loves the same. And that's why kids with Asperger's have to have it this way, that way, exactly this way. It has to be the same all the time. They get stuck in this routine. Okay? The right brain is for reading and math comprehension. So a lot of times, even though an Asperger's kid is incredibly verbal and incredibly smart, he can't put it all together as a big picture and see the big picture of the world. Does that make sense to you? So that is a good way. And this list goes on and on and on. I mean, we could go for hours telling you the difference between left and right brain. And not every kid has all left or all right. But with Asperger's, they have a really strong left and a very weak right. So the functional disconnection syndrome. Kids with functional disconnection syndrome, they don't physically feel the same as other kids. They feel disconnected from their bodies. They feel disconnected socially and emotionally. They just don't feel the same as other kids. Okay, we call this embodiment. And because as the motor system develops, your child, as your motor system develops, and as your postural system develops, and as your senses develop, your frontal lobe develops. Okay, so it's called embodiment. And so the reason why these kids have social problems is they don't feel their bodies good, and you have social skills. You can look at, let's say you look at somebody and they're upset. The reason why you know they're upset is when you look at their face expression, You understand what that face expression feels like on your face because you've had that before. And so then you can have good social skills with that person. But if you haven't felt your body very good, if you have had poor sensory and motor development, what will happen is you'll have poor social skills because social skills come out of your ability to feel your own body. You have to be able to feel your own body well first before you can actually have social skills and have empathy for other people. Okay? When the brain is out of balance, you're going to have a kid that loves TV and video games. They're going to love things the same. They're going to have sensory problems. You know, loud noises may bother them, things like that. Perseveration, they got to do things over and over and over again. You're going to have poor body awareness. They may have, you know, just maybe a little more awkward, not as coordinated as other kids. They're going to have poor gross and fine motor skills at times. They'll have persistent primitive motor reflexes. Now, what are motor reflexes? Well, this is basically what they are. When you're a baby, you have these types of reflexes that you have. They're survivability reflexes. And a couple of them, we test all these in our exam with kids. If you kind of just lightly stroke the back of a baby, they're going to bend like this, and that's called the Gallant reflex. That helps them get out of the birthing canal. If you go like this against their face, they're going to start rooting and sucking. If you turn their head, their arms are going to move to protect them. That's called the asymmetric tonic neck reflex. If you kind of stroke their foot, their big toe is going to stick up. These reflexes should not be there anymore. Within a year, 6 months, a year, they should be completely gone. And the reason why they're gone is because as the frontal lobe develops, the frontal lobe will inhibit these reflexes, so they're not there. Now, they're actually there, but they're being inhibited. But if the child's frontal lobe is not developing properly, if their brain is not developing properly, what will happen is the child will still have these primitive reflexes. In our exam, we will find these primitive reflexes, and if the child has them, the further they're down along the spectrum from ADD and ADHD to Asperger's to autism, the more of these primitive reflexes we typically see. And what we do is we have to remediate these, because as we remediate these, then your child can move into proper development as they go on further. They may be left-handed and right-footed. A lot of times kids with brain delays will have they may use their right eye, but they may use their left ear, and they may use their right arm and their left foot. They may be all switched up like that. They may have poor eye coordination, poor social skills, as we talked about, and their verbal communication, it may not work very well. Okay? They may be able to have good verbal skills, but they can't communicate because the right brain is what's going to allow the left brain to start to function well verbally. They may have abnormal emotional reactions. They may have sensory symptoms where they don't like the way food tastes in their mouth. The texture is really weird. They may have a rapid heartbeat, immature digestion. You know, they may get sweaty palms. They may sweat at night, things like that, because the brain inhibits certain things, certain reactions. So here's the deal. Asperger's is a neurodevelopmental disorder, and your child's brain needs two things to function well. It needs fuel and it needs activation. Fuel is in the form of glucose and oxygen. Okay, so your brain needs oxygen, your brain needs glucose, and activation is proper stimulation. Your child's brain develops from stimulation. Okay, so maybe your child didn't have the proper stimulation in certain areas, and that's why they're having these issues. And so your brain needs these things, and that's how we treat kids with these issues. Again, we treat kids with Asperger's and other neurodevelopmental disorders metabolically and neurologically. Okay, which is fuel and activation. Okay, so let's talk about the metabolic care. We want to run a complete metabolic panel, a lipid panel, a complete blood count with auto differential. We want to run a thyroid panel. We want to run all this. Okay, now here's what happens. Parents will always say, well, my child's already had these tests. They're all normal. The reason why they look normal is because a medical doctor is going to look at the laboratory ranges. The laboratory ranges are inaccurate because the laboratory ranges are the ranges that you see on the right-hand side when you're looking at your child's blood work. Or even your blood work for that matter. They come from everybody giving blood. Everybody in the whole country giving blood, whether they're sick or not. If you go over to Quest, you look at some of these people there, they're in walkers and they're pretty unhealthy. You're the average of those people. I don't want to be the average of everybody. I want to be the average of only the people that are healthy, and that's what's called the functional lab values. They're more sensitive, okay, and so they're tighter. I'll give you an example. I'll give you an example here. Functional ranges. Functional range for blood glucose is 85 to 100, okay, tight. Functional range or laboratory range, the one that your medical doctor may use, is 65 to 110. So you can have a child in the 60s or 67, and that may look normal, but that's reactive hypoglycemia. Your child may have blood sugars that really dip down during the day, and that can really affect them in school. We're also going to run an adrenal stress index. Any child over age 8 to 10, we're going to test them to see how their adrenal function is. It's a salivary test. We can find that out. If they do have poor adrenal stress function, it's going to measure cortisol levels. Cortisol can be toxic to your brain, and it also affects the blood sugar issue. So high stress, kids who are under a lot of stress will have stressed adrenals. Sensitivity testing, absolutely critical for kids with ADD, ADHD, Asperger's, even autism, high and low functioning autism. We have to test them. We test their stool for gluten, casein, egg, soy, and yeast. We have to run the tests. Almost all kids with these neurodevelopmental disorders have high gluten sensitivity. Gluten is a protein. It gets into your bloodstream and your body's immune system reacts to it. And it can create brain inflammation. It can create an addictive sort ofness to, it can get up into the brain. It crosses the blood-brain barrier and it creates what's called gluteomorphines and caseomorphines. And what happens is these things, they become addictive. And when they get addictive, what will happen is your child's going to be like this carb addict. They're going to want to eat all this weed all the time. So they get addicted to these things. We have to run the test. Now here's the thing. Parents will always say, well, I had my child tested for celiac disease and he's negative. Celiac disease is the worst possible gluten sensitivity you can have. It's like 3 different genes that cause it. And most kids are gluten sensitive, but they'll come back negative on the celiac test. Now the celiac test is a blood test, and so if it comes back negative, it doesn't mean your child isn't gluten sensitive. So it's important. That's not accurate enough. So we have to run the stool test. Okay, we got to test your kid for leaky gut syndrome. A leaky gut syndrome is caused by stress. It's caused by dysbiosis. Kids that have had a lot of antibiotics for ear infections, what that will do is it'll kill all the healthy bacteria, and now yeast increases, and then the enzyme in the yeast will start to erode the intestinal barrier. Your intestines are supposed to create a barrier between the food that's coming through your intestines and the blood. So what happens is the food in your intestines has to be digested fully down from proteins to amino acids, from proteins to peptides to amino acids. And then those amino acids need to be absorbed as small molecules through the digestive tract, or through the lining of your gut. And what happens is they get into the bloodstream and then they can nourish your body. Well, if you have a leaky gut, what will happen, it's kind of like a screen door with holes in it. You know, your screen door is supposed to let air through and keep the bugs out, right? Well, if you got these big holes, the bugs are going to get in. So what will happen is protein molecules should be digested down into peptides, and then they should be digested down to amino acids, and that's all that it should get through. Well, if the peptides get through, because now these holes are leaky, then what happens is the immune system, your child's immune system, will think that these peptides are foreign invaders like bacteria and viruses, and then it creates an autoimmune response, which can create brain inflammation. It can cause inflammation in the body. So a lot of kids have this underlying, undiagnosed autoimmune problem that affected the way their brain developed. And so it's vital that we check for leaky gut and food sensitivities. It's absolutely essential. Okay? And we have to run the test to do that. Food sensitivities to gluten and casein can cause irritability, occasional meltdowns. It can cause inability to focus and concentrate, impulsive actions, aggressive behavior, fatigue, bedwetting, sleep disturbances, learning disabilities, lack of attention, lack of focus, poor digestion. I mean, the list goes on and on with food sensitivities. We need to test this. Now, it's very important. If you have a child with Asperger's and you want to get them well, and you want to improve their ability to have social skills and their ability to function and to be all they can be in life, you know, I'm looking for parents that are willing to crawl through ground glass to fix their child. Okay? If you're a kind of parent that's like, oh, I don't know if I want to mess with that, it's so hard, you know, oh God, I don't even test him if I find out, you know. See, if he has this, it's affecting their brain, it's affecting his brain. Okay? So don't come to my office and want your child to get well, but you won't follow the gluten-free diet or the casein-free diet. But we have to run the test. If we run the test and your child isn't sensitive, then that's not the cause of their problem, or it's not part of their problem, then they can eat what they want. But we have to run the test. The other thing we do is an immune panels. The immune panels will look at the immune system and find out if they have an underlying autoimmune problem. We're going to run TMB lymphocytes, cytokine panels. Cytokine panels are your interleukins, interleukin 2, 4, 10, and TNF-alpha. natural killer cell activity. This is going to give us an idea of how your child's immune system is functioning. There's two parts of the immune system. There's the Th1 and the Th2. The Th1 are your T cells, and the Th2 are your B cells. Your T cells can be tested. The number of T cells can be tested through different types of T and B lymphocyte panels, but we can also look at cytokines because T cells create interleukin-2 and TNF-alpha inflammatory mediators, and so we can test for that. T cells are like the army that go out and kill the bacteria, the viruses, or if you've got this constant antigen, which is maybe gluten or casein or food sensitivity, that's going to be the area that goes out and attacks. Th2 are your B cells. Your B cells are interleukin-4 and interleukin-10. That's how we test that. Your B cells are antibodies. They don't go out and do the attacking. They actually go out and tag what needs to be attacked. Well, your child's immune system, Th1 and Th2 should be balanced. If Th1 is higher than Th2, then we have an autoimmune disease. If Th2 is higher than Th1, if it's not balanced, we have an autoimmune disease. Just like the left and the right brain need to be balanced. So we can test for that. We'll find out, does your child have an active antigen or immune dysregulation? Active antigens can be a parasite in his gut. It could be bacteria, viruses, yeast, molds. It could be a food sensitivity, gluten, casein, soy, yeast. It could be chemicals, heavy metals, mercury, things like that. Okay? We can also test for immune dysregulation. So if your child has an autoimmune condition, they're going to either have an active antigen or an immune dysregulation. We can test what's called the helper-suppressor ratio, which is the CD4-CD8 ratio. If it's higher than 2.5, then there's a very high likelihood your child has a big sensitivity or is trying to fight some parasite or some bacteria. If your child has below 2.0, then it's just immune dysregulation, which is secondary to poor anemia or poor metabolic function, which could be blood sugar issues or hypoglycemia, things like that. We can run what's called a DNA stool ecology. The DNA stool ecology is going to let us know if your child has good healthy bacteria or do they have dysbiosis. If your child's had a lot of antibiotics for, like, let's say ear infections, they could have really low healthy bacteria, and they can have really high yeast, or they can have parasites that can affect the immune system. So we run that. That's a test, stool test that we do. We can run something called a PANDAS test. A PANDAS is a pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections. So here's the thing. If your child has OCD along with his Asperger's, or they have Tourette's, it can be because their basal ganglia, which their basal ganglia stops excessive movement and excessive thoughts. Well, if your child has a strep infection, your child could create antibodies that not only attacks the strep, but it can also get up into the brain and attack the basal ganglia. So any kid that has these obsessive compulsive disorders or tics or anything like that, along with their Asperger's, we want to get a PANDAS test done. We can test for H. pylori, which is an antigen in the upper digestive tract. We can check for inflammation, homocysteine, C-reactive protein. We can test for neurotransmitters. We can see, does your child need support for GABA? Do they need support for acetylcholine? Do they need support for serotonin? Do they need support for dopamine? We can run a screening for that, surveys for that. Decreased neurotransmitters can be part of your child's neurodevelopmental disorders or not enough cofactors for those. Once we find out what's going on with your child metabolically, then we're going to put them on a specific diet. If it's an antigen, we got to get the antigen out. If it's gluten, if it's casein, if it's yeast, we got to get that out. If your child has a parasite, we may send them back to your medical doctor to get something that's going to clear out that parasite. Then we can start to replace it with healthy bacteria. If they have high blood sugars or low blood sugars or thyroid issues, and kids can have this stuff at a young age, we're going to put them on specific non-drug supplements to balance and improve their function. We also put kids on what's called glutathione. Glutathione takes the bullet for a lot of these heavy metals that are in our environment. For instance, glutathione will totally help protect your body from mercury. One of the big things is with vaccines, one of the troubles is they have mercury. And the big problem is you give your child Tylenol after they get a vaccination. The Tylenol destroys the glutathione, so now the mercury, which has a high predilection to attack neural tissue, is now left to do what it wants. So we put a lot of our kids, almost all their kids, on some type of glutathione. We may put them on a glutathione cream to help protect them from any heavy metals or any other problems with oxidation, or it can also help balance their immune system. So that's the left-hand side. That's a lot of information there. The question is, has your child had all these tests performed? And the answer is absolutely not. I can guarantee they haven't had these tests performed because it hasn't been changed in 50 years, even though there's a ton of data that says that this is the kind of stuff that needs to be done. But guess what? Typically what they do is they just put your kid on some Concerta, some Adderall, and that's it. Okay? So these tests are very important. And your medical doctors are going to run these tests. A lot of times they'll say, well, patients will come in and parents will say, well, can't I just have their medical doctor run these tests? See, these tests are outside the box. They're not in the standard of care. The standard of care, again, is just drug therapy or counseling, so or educational therapy, which is all good stuff. I'm not against educational therapy and things like that, but I'm against it if you're not trying to improve your child's metabolism and function. Okay? So the reason why I don't run these tests, your medical doctor won't run these tests, is because he doesn't know about them. He hasn't been trained in functional medicine. He's been trained in medicine. Okay? The other thing we want to do is specific neurological treatments based on specific neurological testing. We want to look at your child's brain. We want to do a functional brain assessment. Does your child have a right frontal lobe problem? Do they have a parietal lobe problem? Do they have a temporal lobe problem, a occipital lobe problem? Do they have a cerebellar problem? Now, I will tell you right now that kids with Asperger's almost always have a cerebellar problem. Okay? They're very uncoordinated. They've got poor gross motor skills and they've got poor coordination, usually. All right? It's been studied that kids with Asperger's syndrome have a significantly less gray matter in the frontal lobe, striatal, and cerebellar regions. It's been studied that they have smaller cerebellums. They have smaller frontal lobes. They have decreased gray matter in that area. That controls, and they also have differences in their white matter, white and gray matter differences. So they have less brain development. Okay, and it's always on the right side. Okay, so we have to stimulate that. So we do a functional brain assessment. We're going to do a comprehensive questionnaire. If you are already a patient that's going to be coming in, it's like 7 pages, 8 pages. We want to know everything about your child. We're going to do interactive metronome testing. Interactive metronome is a computer-based program that we can use to help kids develop better function in their brain, but we can also use it diagnostically to see if your child has impulsivity. Do they have decreased focus? Do they have a right brain delay? We're going to look at visual and auditory reflexes with our functional brain assessment. Autonomic function. Does your child have sweaty palms and big pupils and poor digestion? Gait. We're going to look at their posture. Again, kids with Asperger's usually poor posture. Muscle tone. Do they have spasticity? Do they have hypotonia? What is their balance and their coordinated movement? Are they good athletes? Are they bad athletes? We're going to look at all those primitive reflexes that should be remediated or gone at this point if your child's over year 1. Motor performance, heart and lungs. We're going to do what's called video nystagmoscopy. We're going to actually put these goggles on your child's head, if they're old enough, and we're going to measure their eye movements with an infrared camera, and then we're going to find out, are their eye movements good? Eye movements are highly diagnostic of brain function, and we can get a look and see, does your child have a right brain delay based on how his eyes are moving when we have him do certain exercises and certain types of spins and things like that. Spinal examination, the spine is essential. Usually kids that have poor brain function, they have poor spine function. Cognitive evaluation. We'll run the lab test we talked about, and an analysis of previous testing. I want to look at any testing that he's had, the Wechsler test, any IQ testing, the Wyatt testing, all of these different tests. We can look at that. That can give us an idea of what's going on also. Once we find out what's going on, we want to do neurological treatments specific to the parts of the brain that are not functioning well, to create neuroplasticity. Neuroplasticity means we want to improve the way the brain is functioning. Your brain can become more efficient. This is the hottest word in neurology right now, is neuroplasticity. What they found out is that if you stimulate the brain, give it fuel, that brain, just like a muscle, like a weak muscle on one side, if you stimulate it and give it fuel, it can become strong. Okay? We're going to do cerebellar rehabilitation, vestibular stimulation, which is inner ear stimulation, which goes right to the cerebellum, balance training, hemifield visual stimulation with eye lights, auditory and low frequency stimulation, smell stimulation, gross motor exercises, interactive metronome, which is absolutely essential. We'll talk about that more. Taylor visiograph, which is going to look at your child's ability to read and how his eyes are tracking. We're going to run all that. Has anybody looked at that with your child yet? Probably not, because you probably haven't had them to a functional neurologist. So here's some brain-based treatment examples, a lot of gross motor stuff. Chiropractic adjustments. Now, we don't have to use the cracking, popping type chiropractic adjustments that we use for back and neck pain, but we can use an instrument, and usually we're going to do that on the left side of their body to stimulate their right brain. Okay? Because again, it's considered autism as a right brain problem. Okay? Interactive metronome. They did a double-blind placebo-controlled study of 9 to 12-year-old boys diagnosed with ADHD and found that those undergoing IM treatments showed significant improvements over both control groups in attention and concentration, motor control and coordination, language processing, reading fluency, and the control of aggression and impulsivity. This came from an occupational therapy journal. But I want to let you know that that's because the right brain got improved, and we can use the same thing with a kid with Asperger's and get similar type results, affecting more their social skills and eye contact and things like that. We can use what's called a visual stimulation program, which is a computer-based program that's going to cause eye movements. We can use specific types of colors, specific types of eye movements to target certain areas in the brain. Here's the difference between the therapies, okay? Your child has a functional disconnection. Left brain's probably over, in Asperger's it's firing way high. Right brain is low, okay? Here's what medicine does, or just occupational therapy that's not hemispheric based. It just stimulates the brain. So the brain just goes up. But it doesn't fix the disconnect. You understand, drugs don't fix the disconnect. They just speed the whole brain up. What we need to do is fix the disconnect. That means it's hemisphere-based. Hemisphere-based, that's our treatments. And the other thing is we want to look at metabolic capacity. Some kids can only take a little bit of care, and we can look at specific things, like we can look at their pupils, we can look at things to find out if we're overtraining them, so to speak. Okay? Their stamina. Some kids just don't have enough stamina, and we can figure out the exact kind of exact type of protocol care that they need so we don't overdo it. Okay? Neurological treatments, we see them 2 to 3 visits per week for the first 90 days, then we do a reevaluation. They come into the office. Home therapies are a must. Again, parents are involved in this. We're going to give you specific types of exercises. Let's say home primitive reflex remediation. You're going to need to do some of those. Probably 10-15 minutes a day. Again, I'm looking for parents that will walk through ground glass to fix their child. So if you're, I'm not helping them with any home therapies, well then it's probably not a good place for you. Okay? Parents must work with their children at home. We just talked about that. Again, I want to let you know that I work with other providers such as child psychologists, speech therapists, and school staff. I want them to know that what we're doing, I may change the position of where your child's sitting in the classroom to stimulate his brain. So we want to have good feedback back and forth with these people, okay, with these other providers. The results, the program is extremely successful, and the reason why is because we do the brain-based, neurologic, and metabolic approach, but I don't accept every patient for care. The reason why I don't accept every patient for care is because I can really tell if the parents really want to do it and really want to improve their child's brain function, so they're not just, so they're changing the child's brains for the long haul, but I can tell usually when it's not going to work from just when a parent comes in. So I only take focused and committed parents, okay? Questions. How has your child's Asperger's affected your relationships, your family, your finances, or other activities? Very important to think about that. I mean, how is it really affecting you? Okay. Number 2, are you worried that your child's Asperger's will never resolve or never improve? Okay. The question is, how's he going to function when you're not here? What's going to happen when you're not there to take care of your child? Okay. How are they going to do in the everyday world? And that brings us to number 4. Do you want to address the cause of your child's Asperger's, or do you want to just mask the symptoms with medications and things like that? See, we want to address the cause of the problem. And the last thing, are you worried that your child's Asperger's will affect his social ability, making it tough for him to have relationships or to succeed in the real world once he's through with school? I mean, most of what allows you to succeed in the world is your ability to have even brain function and your ability to have social skills, have good eye contact, have good focus, things like that. Okay, so that's basically our program. If you're watching this right now online and you'd like more information on how to have a consultation, how to have a functional brain assessment, put your name in and we'll email you some information on that. Or you can just call our office, 610-518-3370. If you've already had your child in for the brain assessment and you're now at home watching this prior to you coming in for the report of findings, make sure that both you and your spouse watch this. Anybody who is a caregiver, important, bring this in and show your teachers. But when you come back for the report of finding, it's a requirement that both parents watch the DVD, even if they're divorced. And it's a requirement that if you're divorced, it's even a requirement that both of you come back to hear the report of findings. I don't do a report of findings on a child with any type of neurodevelopmental neurodevelopmental disorder if both parents are not there for the report of findings. So that's basically all I have to tell you today about Asperger syndrome. We'll see you when you come to the office. Thanks a lot for listening.